We begin in India, where calls are growing for a national lockdown as COVID-19 deaths remain on the rise. Nearly 3,800 people lost their lives in a single day. Hospitals are struggling to treat patients as they run out of beds and oxygen. For weeks now, volunteer groups have been delivering crucial supplies. DW reporters Namisha Jaiswal and Sharik Ahmad have been to meet individuals who are putting their lives on the line to save others.
Dinesh Sinha has spent the last 2 days right here, on the road in front of a Sikh temple, 50 kilometers from home. His son has the coronavirus and has also developed a severe lung infection. He urgently needs to be hospitalized. But his father says even this makeshift arrangement is a blessing.
These people are working 24 hours providing oxygen cylinders. Otherwise, it's very difficult to get oxygen or to get a bed in a hospital. This morning, I visited 15 or 20 hospitals to look for a bed for him. There isn't a single bed. All of them refused us.
For the last 2 weeks, Delhi has been facing a severe shortage of medical oxygen. This is a life-saving last resort. A free oxygen service run by Khalsa Help, a Sikh group. Volunteers here consider the risks they are taking to be secondary to the central tenet of service in Sikhism. Several of them have already been infected. But those here tell us they aren't afraid. They say they must do something to save these lives.
I go home to sleep for 2 hours, bathe, tie my turban. My wife has never stopped me. It's the immense support we are getting from home that is allowing us to save so many lives. And this is a time where people are even afraid to help their own infected relatives.
Every few minutes, critical patients are brought in. The group has 9 trucks scouring nearby plants for cylinders. The oxygen here is provided for free.
As patients continue to be rushed in here, many hospitals in Delhi have stopped taking in new patients because of the oxygen crisis. They're putting out SOS messages on Twitter, begging for help, as they only have hours, sometimes minutes of oxygen left.
This hospital is one of them. The previous night was a close shave. After waiting for hours at oxygen plants, tagging authorities on Twitter, and even reducing oxygen flows to subsistence levels to make it last longer, the hospital got supplies in the nick of time. Doctors here tell us that supplies that used to last them 2 weeks now evaporate in 36 hours. They cannot predict if the next round will reach them on time. Turning away patients for logistical reasons is heartbreaking for doctors.
When we refuse, many of these patients are helplessly pleading in this profession because they wanted to help other people through their sickness and illness. If they are not able to do that, that by itself is taking an emotional, moral, ethical toll on them.
A rare few do get lucky. Back at the oxygen service, Sinha has finally managed to arrange a bed for his son. Immediately, his cylinder is rolled towards another patient. 2 weeks into the oxygen crisis here, every labored breath is a gift.
And joining us now to talk more about volunteer efforts and helping the sick is Inayat Singh Kakar. She is a health activist with the People's Health Movement, and she is joining us from India. Thank you so much for being on the program today. How are you managing to get relief to the sick when there's so little oxygen to go around?
I mean, it's extremely challenging. I mean, one aspect is that there is very little oxygen to go around because, the daily requirement, the daily allocation of Delhi is not even being met. And the second issue is with regards to information gaps. Now, even in places where there is oxygen available, it runs out very fast. People don't get to know where it's available, where do you go, how do you procure it. Often there is oxygen available in refilling plants, but people don't have empty cylinders. And so coordinating all of this is very, very difficult. But we do have linkages with, other volunteer groups, with people like you showed in your story who are providing oxygen. And we do our best, to get them oxygen. Another big challenge is that, that the prices for oxygen have really skyrocketed. And when you're dealing with a supplier, you don't really know whether they're legitimate or whether it's being sold on the black market. And that is, that's a big problem, because also, I mean, a lot of people can't afford these extremely high prices. So we often also have to resort to fundraising for individual patients if that is required.
We have been hearing that more foreign aid is arriving, foreign help to the country. Is that something that you're noticing on the ground? And if you're not noticing it yet, I mean, how hopeful are you for the future prospects in the next weeks and the next days?
I think a lot of organizations, particularly that are, providing oxygen, there are organizations, Sikh organizations, that have set up what are called oxygen langars, which is basically, I mean, it's a place where anyone can come to get free oxygen. And I think a lot of these organizations are receiving foreign aid. Organizations are flying in oxygen concentrators for individuals, providing these in their homes. We got to know yesterday that, ventilators that arrived from abroad have been distributed to central government hospitals. So we're hopeful that things will see an improvement, but I'm not sure if, if our system has worked fast enough to address the growing crisis. I feel like we're still very much, taking knee-jerk reactions, and we're still trying to fill the shortages, and not really, we're not really able to respond to the crisis that we're seeing and that we will be seeing in the coming few days.
And as you take that really proactive approach, I mean, to fill these gaps in capacities that the system does have in India, tell us, I mean, how are you coping on a day-to-day basis? Your organization, yourself, are you receiving, for example, some sort of psychological support in dealing with what you're dealing with every day? I mean, this is life and death.
I mean, I think it's extremely distressing. A lot of us are not getting enough sleep. We're usually working around the clock. There have been days where, some of us have been sleeping once in 48 hours. There is a sense of, despair when you're not able to help patients. Earlier, we were having to help patients get oxygen at home, but now we also get SOS calls from patients who are admitted in hospitals. And that's very complicated, because when somebody reaches out to you for an ICU bed, you also have to ensure that the hospital has adequate oxygen. And, we don't have access to system resources to be able to do all of that. And I don't think a lot of us are really processing the emotional toll that this is taking. A lot of young volunteers are dealing with cases where patients are not surviving. I think there is this, general feeling of guilt for not being able to do everything to really save the patient. And I think we're all very, very aware of the limitations that we're facing. Our phone numbers are public. We get constant calls for help. We are able to respond to some people. We're not able to respond to some people. But yes, we're trying to set up a more organized form of, providing support and psychosocial support to each other. And in fact, yesterday I spoke to a therapist, asking her if she can do some group sessions online for volunteers, so that we can deal with this collective trauma that we're all facing. And I also worry and I also fear for for what's going to happen once all of this, also goes down.
Well, you're doing incredible work under difficult circumstances, and we know that your time is also very precious. So we thank you so much for taking the time to speak with us here on DW News to tell us a little bit about what you're experiencing there in a volunteer capacity in the country as the death toll mounts, as we mentioned. Inayat Singh Kakar, health activist with the People's Health Movement. We appreciate it. Thank you. And Germany is about to send its second shipment of emergency aid to India. The Air Force has already sent a plane with 120 ventilators and medicine. Also on board, a team of medical experts. Several European states and other countries, including the U.S. and Taiwan, have also joined in the aid effort. And Benjamin Alvarez-Gruber is standing by in Wunsdorf Air Base in Lower Saxony, Germany, from where this shipment just took off. Benjamin, what's been happening near you?
That's right, Sarah. We're standing right next to the runway here at the Air Force Base of the German Army of the Air Force. Just a few minutes ago, the A400M military cargo plane took off to Abu Dhabi to then continue the trip to Delhi. As you just said, on Saturday, another plane landed already, sending a crew that will help to operate this oxygen generator machine that is on board of this plane. There will be a German team helping their Indian colleagues to use this machine that compresses air, to use it for oxygens for several hospitals that are in dire need to get it.
Germany joined some 40 countries offering aid to India. Tell us a little bit more about the efforts and how far they might be able to go.
That's right. Germany is joining more than 40 countries. Over the past days, there have been a lot of cargo planes arriving from Australia, from the US, from the UK. What is special about this shipment that Germany is sending? So we have this takeoff today. We'll have a takeoff tomorrow as well with the same plane, an A400M Airbus cargo transporter. What's interesting is that the German team will stay there. The first team arrived on Saturday. They assessed the situation there. And we talked to several officials before this live, and they told us that the security aspect is also very important if we consider that there is indeed a black market of oxygen in the country, and also over concerns that the aid that several countries are sending is not reaching the hospitals and is still in customs, for example, in airports or in several halls that have been put in place by the government. So that's also a fear when we look. There's Indian media reporting that the aid is not reaching also other regions in India. So they will be really careful that this machine and all the help that is being sent to India right now can be used as soon as it arrives there.
DW reporter Benjamin Alvarez-Gruber, thank you.